So there are two routes to becoming a surgical termination provider. The first is the specialist route. So that's through the Royal Australian and New Zealand College of Obstetricians and Gynecologists, which we shorten to RANZCOG. And that is for specialty trainees going through their training in hospital. And generally at the registrar level, they can opt to undertake modules and training to become skilled in providing surgical termination. And that can then form part of their general obstetrics and gynecology services they provide, either in the public system or the private system. The alternative route is the one that I followed, and that's by being a GP. And then you can receive specific training from an organisation such as Marie Stopes or other providers, specifically in the skill of providing a surgical termination.
Doctors who are already specialised in obstetrics and gynecology or have what's called an advanced diploma, don't need to do any particular training. Other medical practitioners are required to take an online training course, which is easy to access.
You need to register with the online course that is run by the pharmaceutical arm of Marie Stopes Australia called MS Health. It's a free online course. It takes about 2 hours to do. It's very comprehensive, which I entirely agree that it should be. There's a lot to learn. There's a lot to know. Once you've done that course, you become a registered prescriber of mifepristone, and the overarching drug is called MS two-step. You then need to become affiliated with a pharmacy who is also registered to dispense, and then that's it. At the moment, nurse practitioners are unable to do the course, but there is currently a lot of lobby and advocacy going around that area, so that hopefully in time we will see our nurse colleagues also be able to provide this service.
It does probably also require that you have some background knowledge and experience in women's health more generally, understand the context of unplanned pregnancy and where that fits in sexual and reproductive health over women's lifetime. And it's also important to think about setting up your practice so that you can go ahead and use that training. So there are practical things like local pharmacists to supply medication, local hospital in case of any complications or follow-up needed, access to radiology for ultrasound scans. Another thing that is relevant in general practice is to think about your whole practice team and whether everybody in the practice is aware of the fact that you're providing that service. And I guess it's important to identify if there are any staff within the practice that maybe don't feel comfortable with that or need to be made aware, and just to have a discussion about that so that women who seek that service from you don't experience any negative input from other members of staff. The final thing I would say is really important in terms of preparing to become a provider is to think about where your support is. So other providers who are already in your local area or elsewhere providing the service, who can just give you some support and guidance, particularly in your early time, just about any particular problems or questions that you may have.